Hi, I'm Dr. Stim, and this is about taking pills. We take pills for two reasons: to relieve a symptom, like we take Tylenol for headache, or to cure a disease, like penicillin for infection or Prozac against depression. I'm talking here about symptom relief. For example, Tylenol for a headache, we usually take 2. And the question is that the right dose? And the answer is no, not for everybody. We're all different, and we have to know our correct dose, and the only way to know that is to experiment. You experiment by cutting the pill in half and quarters, and next time that you get the headache, we talk about Tylenol, you try a quarter, and you might be surprised that that quarter might relieve your headache. Or if it doesn't, then you take a half. Or if that doesn't, you take 1, up to a maximum of 2. The point is that in many cases you'll find that you need to take less medicine than was instructed. And you're saving yourself a lot of money and a lot of problems with side effects. Most of us think we should put the pill in our mouth and swallow it. But is that the best way to take a pill? And the answer is no in most cases. Because when you swallow a pill, it goes into your stomach. It's often mixed with food or stomach juice, which first of all dilutes it, and secondly weakens it. And then it gets absorbed through the stomach lining and goes on a first pass to the liver. And the liver detoxifies or neutralizes everything that goes through it, and therefore the medication is often weakened. And secondly, the liver may be harmed by the medication, and the highest dose of that medication is going on the first pass. It's much better to take most of the medicines in the mouth, to hold it in the mouth either under the tongue and allow it to dissolve, or to chew it up. And the reason for that is, first of all, you avoid the problem with food, with dilution, and second of all, it gets absorbed into the arteries, small arteries under the tongue. It goes directly to the brain and the other organs without passing through the liver. And this is very good if you're taking a medication for headache, for tranquilization, for antidepressant, because it goes the maximum dose going to the brain and you're having no bad liver effect. And another good effect of holding a pill in your mouth versus swallowing it is that you learn the taste of the pill. For example, aspirin tastes a little bit sour. Opioids and ACE inhibitors taste a little bit bitter. Some vitamins and beta blockers taste sweet. And there are various other tastes. And the advantage of this is that someday in the future, you may confuse 2 pills that look alike and take the wrong pill. Or even worse, somebody may purposely give you the wrong pill, substituting. But if you hold it in your mouth, you'll immediately know that you've got the wrong pill because it doesn't taste the way you know a pill that you should take ought to taste. Basically, there are 2 types of side effects to taking pills: overdose and allergy. You know you've taken an overdose when, for example, you take a 5 milligram Valium pill for tranquilization and you find you can't keep your eyes open because you're so sleepy. That's overdose. We see the same thing with perhaps sleeping pills or other types of pills, and that's easy to deal with by just reducing your dose. But allergy is a different problem. If you get an allergic reaction to a pill, and we all know what that is, either you get a rash, or your face swells up, or your blood changes, you should never ever take that pill again because it could be fatal. And the way to reduce the incidence of allergic reaction, as a generalization, is to keep your pill taking to a minimum that your doctor will approve of. And try to take the least pills as possible to either relieve your symptom or cure your disease. Now I've given you a few useful secrets of taking pills. For many more and other useful information, read Physician's Notebooks, the medication chapter. And you can see it on the website just below.